21. Your patient is a 76-year-old male who is complaining of malaise. He has no medical history and takes no medications. His BP is 112/70, pulse is 60 and irregular, respirations 20, lungs clear and equal bilaterally, skin is warm and dry. Figure 5.1 depicts his ECG. Pre-hospital management of this patient includes which of the following? A. Oxygen and monitoring only. B. Oxygen and 4-atropine. C. Oxygen and transcutaneous pacing. D. Oxygen, atropine, and transcutaneous pacing. Answer: A. Explanation: this patient is suffering from second-degree AV block type 1, Wenckebach, which is an intermittent block at the AV node. Generally, no treatment is necessary for stable patients with second-degree AV heart block type I other than oxygen and monitoring. 22. What does the initial symptom of infection with HIV primarily consist of? A. Mild fatigue and fever. B. Encephalopathy. C. Kaposi sarcoma. D. Pneumocystis carinii. Answer: A. Explanation: although symptoms of full-blown AIDS include Kaposi sarcoma and opportunistic infections, initial symptoms of infection with the AIDS virus often consist only of mild fatigue and fever. 23. A 63-year-old male is complaining of substernal chest pain radiating to his left arm and jaw. He is diaphoretic and cool to the touch. The cardiac monitor shows sinus tachycardia. The patient's vital signs are BP equals 136/70, P equals 118, and RR equals 16. You have administered oxygen and established in 4. What should you do now? A. Defibrillate immediately with 200 joules. B. Prepare to administer atropine for push. C. Sedate the patient and then proceed with synchronized countershock at 50 joules. D. Administer sublingual nitroglycerin and evaluate the patient's response to the medication. Answer: D. Explanation: the patient's heart rate is not fast enough to be the primary source of the chest pain. Therefore, administration of nitroglycerin may resolve the chief complaint, which in turn may slow the heart rate down. 24. Your patient is a 78-year-old woman who is complaining of diffuse abdominal pain, nausea, and vomiting. Physical examination reveals abdominal distension and absent bowel sounds. You should suspect she has which of the following conditions? A. Bowel obstruction. B. Aortic aneurysm. C. Esophageal varices. D. Gastrointestinal bleeding. Answer: A. Explanation: the patient is displaying signs and symptoms of bowel obstruction. 25. Atypical signs and symptoms of myocardial infarction that are commonly seen in elderly patients include all of the following except: A. Confusion and fatigue. B. Syncope. C. Tearing chest pain. D. Neck pain. Answer: C. Explanation: tearing chest pain generally indicates a dissecting aneurysm, not an MI. Choices A, B, and D are common atypical MI signs in elderly patients. 26. Which breathing pattern is characteristic of diabetic ketoacidosis or other types of metabolic acidosis? A. Ataxic breathing. B. Biot's breathing. C. Cheyne-Stokes breathing. D. Kussmaul's breathing. Answer: D. Explanation: Kussmaul's breathing is characteristic of diabetic ketoacidosis. 27. Normal vesicular breath sounds are usually described as having which of the following characteristics? A. Medium pitch, medium loudness, with equal inspiratory and expiratory phases. B. High pitch, soft, with a long inspiratory phase and a long expiratory phase. C. Low pitch, soft, with a long inspiratory phase and a short expiratory phase. D. Medium pitch, soft, with a short inspiratory phase and a long expiratory phase. Answer: C. Explanation: the correct description of normal vesicular breath sounds is low pitch, soft, with a long inspiratory phase and a short expiratory phase. 28. What is the purpose of the OPQRST mnemonic? A. To obtain the medical history. B. To assess the neurologic status. C. To assess the respiratory status. D. To define the major complaint. Answer: D. Explanation: The OPQRST mnemonic is used to define the chief complaint associated with medical conditions such as pain, dyspnea, dizziness, and vague sensations. It is not usually used in trauma or actual unconsciousness. 29. Your patient is a 70-year-old male. He complains of chest pain that began while he was raking leaves. You perform an initial assessment and a focused history and physical examination and administer oxygen and nitroglycerin. The patient then states that he feels much better. What is he most likely suffering from? A. Stable angina. B. Unstable angina. C. Myocardial infarction. D. Cardiac arrest. Answer: A. Explanation: the pain of stable angina is brought on by exertion and relieved by rest, oxygen, and nitroglycerin. 30. A 25-year-old female complains of diffuse lower abdominal pain, vaginal discharge, and low-grade fever. Which of the following conditions best describes the patient's presentation? A. Pelvic inflammatory disease. B. Ectopic pregnancy. C. Kidney infection. Deep ovarian cyst. Answer: A. Explanation: PID causes lower abdominal discomfort that is difficult to localize and often has an associated fever. 31. What do the signs and symptoms of hypertensive crisis include? A. Pitting edema, tachycardia, tachypnea, and venous congestion. B. Paralysis, seizures, headache, and altered level of consciousness. C. Severe respiratory distress, apprehension, cyanosis, and diaphoresis. D. Restlessness, confusion, blurred vision, nausea, and vomiting. Answer: D. Explanation: the most common signs and symptoms of hypertensive emergency are restlessness, confusion, blurred vision, nausea, and vomiting. 32. Why are vital sign changes not a good early indicator of shock in a young, healthy adult? A. Patients often display false positive vital sign readings during shock. B. The vital signs are often too low to be measured accurately during shock. C. The body attempts to compensate by maintaining normal vital signs. D. Signs and symptoms of shock are based on neurological findings only. Answer: C. Explanation: the body's physiological mechanisms compensate for the insult that causes shock, maintaining normal vital signs early on. 33. During an emergency delivery, the newborn's head presents in the canal. After suctioning, how can you assist with the delivery of the anterior shoulder? A. Gently pull on the infant's head. B. Gently guide the infant's head upward. C. Gently guide the infant's head downward. D. Rotate the infant's head to the transverse position. Answer: C. Explanation: the paramedic can gently guide the head downward to assist with the delivery of the anterior shoulder. 34. The physiological cause of the anxiety and restlessness that make up the classic early signs of shock are a direct result of which of the following phenomena? A. The release of catecholamines. B. The decrease in cardiac output. C. The rise in blood pressure. D. The constriction of arterioles. Answer: A. Explanation: the release of catecholamines that results from the initial drop in blood pressure causes the feelings of anxiety and restlessness. Answer questions 35 to 37 on the basis of the following information. You arrive to find a 65-year-old male in acute respiratory distress. You hear wheezes from across the room, and you note extreme accessory muscle use. The patient has assumed a tripod position and is breathing through pursed lips. Your physical exam reveals a barrel chest and stained fingernails. Vital signs are blood pressure 160/90, pulse 100, strong and irregular with atrial fibrillation on the cardiac monitor, and respiratory rate 40, with shallow and labored breathing. Auscultation of the chest reveals wheezes and diminished lung sounds throughout all fields. 35. What is this patient most likely suffering from? A. Chronic bronchitis. B. Anaphylaxis. C. Asthma. D. Emphysema. Answer: D. Explanation: this patient is exhibiting the classic signs and symptoms of emphysema. 36. Which of the following medications would not be used to treat this patient's condition? A. Methylprednisolone. B. Epinephrine 1:1000. C. Meperidine. D. Metoprolol. Answer: B. Explanation: Epinephrine 1:1000 is not indicated for this patient. 37. Why is this patient breathing through pursed lips? A. To provide positive pressure to inflate the alveoli. B. To minimize mouth movement during ventilation. C. To try and retain carbon dioxide in the lung fields. D. To blow off carbon dioxide to increase blood pH.
Answer: A.
Explanation: breathing through pursed lips is a compensatory mechanism used by COPD patients to provide positive and expiratory pressure, which forces more alveoli to inflate. 38. Under what circumstance could the pulse oximetry reading show a falsely elevated reading in a patient? A. When the patient is exposed to radioactivity. B. When the patient is exposed to carbon monoxide. C. When the patient is exposed to pyrexins. D. When the patient is exposed to carbon tetrachloride. Answer: B. Explanation: carbon monoxide poisoning can cause a falsely high pulse oximetry reading. 39. Which statement about airway obstruction caused by the tongue is incorrect? A. The tongue is the most common cause of airway obstruction in an unconscious patient. B. Airway blockage does not depend on the position of the patient's head, neck, and jaw. C. The esophagus and epiglottis can contribute to airway blockage in an unconscious patient. D. The tongue can block the airway only when the patient is recumbent or supine. Answer: D. Explanation: blockage of the airway by the tongue can occur when the patient is in any position. 40. Which technique should you use to open the airway of a trauma patient? A. The head tilt/chin lift.
B. The jaw thrust.
C. The head tilt/neck lift. D. The sniffing position. Answer: B. Explanation: the jaw thrust is used to open the airway of patients with suspected cervical spine injury. Any trauma patient with questionable or unknown mechanism of injury should be assumed to have a cervical spine injury until it is ruled out.